just a day after nurses and midwives across the country declare a full withdrawal of their services from public hospitals. Members of the Ghana Registered Nurses and Midwives Association declare striking, a graduated strike. What it meant is there were some days when we withdraw partial, and as when we a partial withdrawal of services. And a free NRA, and that was for 5 days. Partial withdrawal was for 5 days. It from the 4th to the 9th of June. And NRA 9th June, umu declare full withdrawal of their services from government hospitals. And any government hospitals it is almost dead. Because nurses and they even extended it to a nurse won't be a lecturess or nursing training colleges near the Omunyana so everyone the Juma at her. It's a serious situation in our country at the moment, and the minister in charge of health and the deputy finance minister a press conference from the Jubilee House. Erin Sembebrina Etruja. I would share with you excerpt of that press conference. The minority in Ghana's parliament, minority members on the health committee in parliament, a press conference, and would go live to parliament here because we honor etumi abremo. Our show would be heavy today on the nurses and midwives strike because it's at the center of healthcare delivery in our country. Already, yenya report of ebusuya binumu a washre wan adofo. One will not be able to pinpoint there directly as a result of the strike, but some of them the one patient move from one hospital to the other baby umbenya ayareshe amawon and namso maybe num drew private hospital and also mokokonya ayareshe no na too late ama onwewu. We have some of those stories are ene yenemo ebeche wherever you are listening to us from around the world. This is the big story in our country, Ghana, at the moment. Enye nikasem ba ene yebe kom na afi yahwe said the nneoma ABC ako. It's a sad way to start this show. One other thing in so and say the agreement a nurse for any midwives at Ghana any Ghana buying a richie in 2024. That was under the SWAL NPP administration, and a nurse for any abiding a richie that agreement. Any details of that agreement no leaky onto social media. Yensa aka copy will be sharing with you details of that agreement. No, the nurse for any abiding anyone sa esha as part of one conditions of service. It was deferred to this year for implementation. It so happens that this year, no, a for front I take over. And no na kwakofa in some way, because the new government thinks to study the agreement and to be able to implement same. Next for so free say we no ya sign every year near Ghana buying assign every year. It is a new abaya bakrana. Just go ahead and implement. And tianona a this stalemate no abba. And we've been told in the press conference, say, abai chemua nurses no conditions of service or money abai that no assign, you know. It was not factored into the 2025 budget statement. And so we implementing it this year, it will throw government finances off gear. Because according to the finance ministry, you know, government will need some 2 billion Ghana cedis to take care of Nioma was our conditions of service we munyana abai here an extra 2 billion Ghana cedis. The government thinks this year that may not be possible. In Tiankomo share the accord next year for implementation. Nurses nese dabi because more other colleagues in the health sector no enjoy more conditions of service for money are buying negotiated. Why not them? That's the stalemate now. In Tiabekum na ye the details na abremo. You can join us on YouTube Asempa 94.7 FM. Na o de will comment no eguho amayen. Me hu baby awo share ifi. We would appreciate that. Sound so ena say or online oko my joyonline.com adomonline.com ubetimi etie yen ewo ho ye wo WhatsApp number nso a ubetimi do messages afaso amayen 0548 443 523 0548 443 523 mi sisubio 0548 443 523 na yentie de wo emayen enewie on all the issues ayedi hon komo mamena production team no ase Dominic Isiyeboa Nana Chumberima Jackson or saying Tiamoa Ebenezer Tete Oman Hene Kwabena Sante ena Equia Boachewa Yadom. You may also want to help us thank our proud sponsors. Omabo Mohammed Fontina 74, Royal Kingdom Estate, Provident Insurance, Africa Queen Mackerel, EcoBank Ghana, Blue Star Lotto, Syntex Tank, Powerjet Batteries, Franco Trading Enterprise, Millennium Insurance, Tabia Herbal, and a Felisco Sun Ghana Limited. And you may call it Ekosiisen Abremo. Nana Kriamwa Boatin se Utien from Dansoman Asore Dayon na Ochia Bright is selfie Komi ono National Affairs Vice Chairman of the NPP. Odysseus TV says watching you from African University of Communications and Business AUCB, formerly AUCC at Adabraka. Okay. Kwabena Ajemani Yeboa or say if the agreement was let me see. If the agreement was in 2024, why did the finance minister not include it in this year's budget? Okay. Asamwa Kwejo Ose O Sapeman O Shane. Ose Obi, if you are married to a nurse, you would understand their actions. The government should change their posturing. They are not asking the government to pay all. Asamwa Kwejo, I'm actually married to a nurse. Maybe a nurse, I understand it well. In fact, one thing that's mind-boggling, and they say, so be a nurse, na oyare, na oko hospital or no aye juma wumukre wosotia. It's crazy. I can't believe it. But it's been there in the Ghana House Service all this while, and I'm surprised. And Obia Enwe said, "This is insensitive. This is unfair." Why we've waited and allowed such a policy to go on up until now? No mentia say nurse ni yare na hospital no aye adwuma wom okose ye nhwe ne yare wo so otua. Charlie. Okay. Edward Kumsin says, watching you all the way from New Yakase, close to Enchi. Wow. I'm watching you from Agape with my wife, Nana Yaroda, the Nova Plus. Yeah, that's it. Tony Signs. So, Staten Island in New York. The nurses should brace themselves for a bumpy ride this 4 years. Obi, you are live in my living room here in Jacksonville, Florida, US of A. Greetings to your team. Thank you, Mante Patrick. We appreciate it. Eben Bafo says, watching you live from Frankfurt in Germany. Greetings to my mom, Mami Amma Bay at Achim Achiase in the Eastern region. And Ospelena Akim no enye correct. Papa ni Achim Achiase. In the use Achim no. Owusu Sapon says, Obi, this week I'll bring you and your team Kelewele Guy. You would enjoy it, pa. You guys are awesome. From my restaurant, Nana Guy. In the Nana Guy, Bebre Kelewele Guy. Nana Yate. Yeah, train Kelewele Guy, you know why? Charles Cheneboa, also a friend from Innova Alexandria Hospital in Virginia, US of A. Ken Bobby, the dining hall prefect. Okay. Evans Odame Kese, or say, watching you live from Italy, Bassano de Grappa in Vicenza. Bassano de Grappa. Wow. So. We say, my children's love Obina Orebano music. Okay, my children love the Obina Orebano music. They always sing when they hear the music. Kobe Uswansa. Wow, that's impressive. Yeah, that's it. Watching you from Girona in Spain, Bay Charles. Nipane Dawson. Yeah, the munina I say, and no, I don't know, sir. Yenye community concern, or we move straight into our interviews. Ekosiisen so high Sempa FM. We say hi Obi, special greetings to my beloved lady at the Flagstaff House, my lady Joyce Bauer Mokhtari, always imbued with smiles. She's jovial and caring to the masses. A very special week to her. Piqué in Elembele. Piqué owo Elembele. Odia breye ini. Yedase. Eish, Obi, what happened to health insurance? Why should a nurse be treated for free? This only happens in Africa. Okay. We say Obi, Sam Jata George has delivered. Let's clap for him. Oh, really? BBS wo the ministry wana. Sam George. Oh, okay. Okay. We say Obi, good afternoon. Listening to you live from a Suboy. As the BEC starts tomorrow, my MP, Honorable Ida Adjoa Asiedu, is distributing writing materials to the candidate in the constituency. She's really working, and I want to say kudos to her. Obano, political father, Ewo Ayen Swano. Obi, tell the government to sack all of these political nurses and replace them with new ones. What is this? Sabla, Ewo Spintex. In fact, government are calling on retired nurses and midwives. Say, Omun Sain Emra, na Omumra Meboa, Ewo hospitals. No, Obi, D-Levy, no, the Akela Intia. Government should drop it. Greetings to Hajia Safia Mohammed, Master Planner Junior. Obi, should I be exempt from paying taxes if I work for GRA? South Riding Frederick Edie no. In fact, the government thinks it is something that should be given to the new agreement no more signing on to now. In fact, not just nurses, nurse no any spouse, and then collar below 18, say 4, say 3 should be taken care of. Because in the private sector, your employer will put you on an insurance. In the government can also put them on insurance, which premium would be paid by government. Those arrangements can be made. Bottom line is a nurse working on one hospital should not be paying. It doesn't really make sense. Obi, good morning. Government should just create employee health in their various hospitals to be used by these health workers. The hospital I work at has this. Kwame Washington DC. Kwame Yedase. Hi Obi, listening to you live right now at my desk in Markham, Ontario, Canada. Donnell K. Odie Enono. We say Obi, my name KG Shabashi in Amasaman. We teachers pay every single thing for your child in the same school you teach. You can't believe it. And if I know some teacher for this and about school, what private sector schools need be and say teacher neighbor school who tria half school fees will be tria half. But I say neighbor will no tria full school fees. All of these things can be looked at. Whereas greetings, Obi. To be honest, nurses are very important to the nation and all other workers. I think the nurses should think of the nation before they strike, knowing the nature of their work. Now we are losing our loved ones, for which reason, Obi, they must reconsider their decision. Carlos, Ewo Johannesburg, and or the way Abba Carlos Yedase. We say, Obi, please, I am Benzena while listening to you live from Ukwapeman School, Ekropon Equiapim. Good afternoon, Obi. Watching you from Pickering in Durham, and I said Durham region, Ontario, Canada. Greetings from PIWC Scarborough to you. Greetings to the NPP Toronto executives and the executives of the Etiwa East constituency. Pastor Akoto Edie Enono. Pastor, thank you. Obi, good afternoon. I'm listening to you from Bristol, UK. God richly bless you and your team for the good work. Loads and loads of your messages already coming through. We say, Obi, won't the retired nurses be given any stipend if they provide volunteer services? Have the volunteer services been factored into the budget? What's the meaning of this shenanigan? Diplomatic citizen in Dansoman. Obi, good afternoon. I am Moses, listening to you from Takrade near Market Cycle. Moses, thank you. Isaac Isuman says, Obi, is the minister really interested to engage these nurses? What is the essence of calling on the retired nurses when you can actually engage better? He is rather making the nurses angrier. Isaac Isuman, Ewo Achimota. Obi, good afternoon. Watching you live from London, Regan Asamoah Asante. Regan, thank you. Obi, I'm watching you quietly from London. But thank you. Obi, please wish my son Enoch Ment Boa good luck tomorrow in the BSc exams. May God bless you. Watching you live from Point Pleasant in New Jersey, US of A. Asempa FM so any ma yenye we na fe yemie phone lines no enhwe say yebetimi afa mo calls kakra ba we Chief Yeboah enne wa woda happy birthday to you and live to be 94.7 and beyond. Chief Yeboah in charge baby as a whoop police reporter obekwa general your friend is saying Nima police station eho and a Chief Yeboah in charge and Chief Yeboah awoda chief happy birthday to you. Have a fantastic birthday and live to be 94.7 and beyond. Let's get into the issues. Yatin so say any but first let's listen to Honorable Kwabena Minta Akando press conference oyeno ene ewo Jubilee House or no any deputy finance minister any address press no yenti ensem no mo ditu dwane bi efa nurses ne strike no.
Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The ministry will in the next few minutes publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns. In conclusion, government reiterates its commitment to dialogue with the GRMA with a view to resolving this impasse for full nursing services to be restored. Thank you for the opportunity.
Good morning. We've all heard the Minister for Health. And from the Ministry of Finance, we want to show our commitment to help in resolving this important issue because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year. And we believe that they have all seen the hard work we are all doing to manage the economy better. We want to appeal to them that they should let us sit down and discuss what can be accommodated so that we can all have a win-win situation for all of us. Thank you.
Asempa FM
94.7 Asempa FM inti the voice na motie ne last ye honorable Ampem Nyako ono ye deputy finance minister and motie nka earlier honorable Kwabena Minta Kando health minister and so voice and motie essentially the abaye Kenya ne say yes they are committed to engagement, further engagement with nurses. Omo conditions of service, no, but omo implementing it this year, it will throw the budget off gear because omo conditions of service, no, omo factor into the 2025 budget. In the abide, me I implement I just a next year budget, no. And umbetimi ede ashim and omunyina eka condition of service the nipa bebe na bebu sane say nurses the condition of service no den na nurses no any abinda da na assign onto ye wo details ne wo ha ye ne mo be cheni nyina one after the other na mo hu ba first mamene PRO edema Ghana Registered Nurses and Midwives Association in the Enkomo Joseph Krampa Joseph akwaba na te saying good. Must start a feeling the public pressure. Say I say must strike na air bite dodo inti amount for bibena air shesanka chale amount for kwani adinti. You should end this immediately. Namun sign koye juma. Some pressure na start a build wamuso.
Yo, me da say. Akwanya idea mamintia ti mamu phone na netitro. Nurses ne midwife omo. I the Ghana Registered Nurses and Midwife Association. The other must say some support to leadership I do sabri. No more can you see anymore. Yeah, quack or day mamo. Some rightful condition of services. Apano ebe implemented a my now. Meaning as our pressure not there. Yati bebre. Now the attorney say yasem ya bakope. Abayin sign your crata or sign crata na. The bit we have as our children of Pakrani Equajuma.
It means for mono further engagement and negotiation there it is not on the table.
Ninyana beba because aside finance minister are sign conditions of service ya negotiated we ama ono employer na sign na yen so ya sign na ka se on be implement no meeting bia bia no engagement bia no you should focus on that.
Condition of service no mo sign that ben
me pa cho yeah, the free 2020 background conditions a woman is every 2 years be I will see a review so document no.
Okay.
I think 2022 now go see a review. Now it says 2023 up to 2024 ending. But omo delay na kakra ma ya ko say 2023. It 2024 May. And the year is share no.
And amu wie negotiations on this new condition of service.
Employer na sign.
Okay.
And I so ya sign say bibia di mu a I was a chance here, Juma.
And no year 2024 month, baby.
2024 May.
May. Na Murie May na Munina Musai, you know. Other than implementation and take effect.
Implementation, no. Can I assess here? And a faction back or the air court. and a court the injunction to implementation also.
December
2024 and a court in the January. Almost implementing my
na faction ben na de moko almost your nurses nibia.
My nurses maybe almost psychiatric nurses Ghana or say you be Papin or say you be. Omo ya kakrevi.
Omo no nurse sa.
Omo nurses up to now omo nurses but omo right to protest.
I get you. But omo no strike we no sa for no ka ho.
Omo say omo nka ho so eno na ya asem no. Enka na ya implement adi. Mon chef say ya implement kra na mo so mo bi amo meboy. Mo say dabi. Ene ye ko strike so ma ya hu no kra ewo mu a. Mo say mo nka ho. Strike na ya ko no ma ya hu say sa na ministry no ni ye ndi ni ye. Ye no mo ka nyina ye tro. Cause the more contra meeting I go much me aka say sa budget kra nya nka cha idea. Na sa meetings ni committee a ye set ni ne ma ne ma mo ka ne letters am say mo kire no. Say mo ba be implement no. Na ne no kra no way.
Inti me pese e fa no one by one. Inti last year you are saying say May na mo signing off this condition of service we no. Senya court na sa splinter group ni dem call ya. Anka abine implementing last year.
Exactly ko implementing bibia.
Okay. Inti fast forward ena court ne ka say abine hwe na beginning of this year no implementation in adwuma.
Exactly.
Ena abine sesan in the abine sesan no new health minister was appointed on the more days. The last time we didn't come, so on the machine 5 to 6 times. In some engagement, no. Na yen komo be no muni mudi.
I don't know make say. So you come na. No make say so you actually letter. They come finance minister. Na letter na say mistake bi wo munti. You be correct no. You be we you be come. Enti omdi meeting ni said afofro. You be ko bi samu a. Omdi na minister wa tu kan. Pani yakwa mama ya be form committee my yase adini ya negotiate wie ama banya no wo so na employer no at that time no wa sign some implement e bi mo dey o ma implement o mo dey o mo enjoy no yes ye dey no ye ne den
na che say
other na mo krokro ye sa na de no kra no mo nyan capture no budget mu na mo nka no kra nkyere ye Monko ka mo 2026 anko na mo tinye pe. Sa mini budget yi kra mo ba be ready. So mo kan no kra say ho kra mo de be say ya. E bia ka ma manfo bo ajo. Ye ntumi transfer to 2026.
Na just say bi o mo ka say mid-year budget no. O mo de shemu ho ha. Anka no mo be ka na
ka ya usa ben. E bia na nka e bia o. Na ka ye nkwa members yi ya je o ma ka sa me ya hwa ade. Ni nyina o mo nka na mo de ko 2026 bia. Na ya say nurses for no ye mum badu ye any midwife no ye juma ye no mum sector
na time
January no and ye dey copy no mamu say na court aka say mo implement ye dey mamu January na mo ba be ready budget I don't na man capture budget no na na mo ba be ka say man capture
na January na mo start ni omo ekasa ye no omo share mo bo say omo be factor into the budget ana
I say mo dey budget in your budget assembly here conditional of service and our employer no once our man sign we no abey statutory order what say we employer no we implement it.
Yes.
It in your budget no na ye dey say ye dey say ye say obe implement so dey be budget mu a enu nti na ye dey bra January no it dey ye wo say dey ye na say midwife no ye dey be akose budget no
it is see asa en komo say omu implementing it this year Abai would need additional 2 billion Ghana cedis on the compensation budget. Na no so no ebe to Abai sikasem up like it will throw it off gear into ombetimi aya just a code next year and no mu nyintum
da bia nyintum sa if you say ye bia de no ba betira ansa na wo kwa akotena si agro sa budget. The reason now ye pay who say I didn't see no man farm for our budget no. So now they are more respecting the work we are doing in the country. I don't know others maybe our modi or implementing and say bimu kaka so mo cost strike for the allowances. What to mean as ikare ko tia emo. Na ye de na dia say and say e ko bon hasam kra na yete. Yan ko ka mo say ye nyan capture. And look at it. I an insult to our profession. That's a ye won here. Ye won here ya ka mo de shemu.
Asempa FM.
But the other way so NSA Oterenka me pato.
It's a very faint.
Oh, sorry. Yes, me pato. Good. Nami busa say that's fine. Nami busa say o say other unions be omo de no ya shas ye implement it. Other unions in the health sector na.
Other unions yeah the yeah omo say omo nka yeah strike yi
yes
omo nyina ka condition of service no but the other sectors Ghana other associations are omo under health sector even in the country e bi mo why implement omo dey omo enjoy ofe na mo delay dey na be do sadly yeah kasa mo say 2026 e go say no way
na aban so say nurse for no mo ye be 120,000 mo numbers no mo doso additional 2 billion Ghana cedis compensation budget
and then the aban see doso about 128,000 yes ajuma na ye no say 128,000 no ni mo a nka health sector no ajuma na ye betumi aye adan ne nyina ye bi di wo chance mo no so bi mo nsa se mo de ye ma mo ni bi anya nyina dodo na na ye de ye sa ajuma no and now you can say yeah GRNMA out of the 128 you have 96,000 that 96,000 you see the near go kakra na aka na omo say omo de omo nko na near ma de omo mbe follow due process no omo timi so ade na no e ye ni sheka ye kan say engagement o any engagement o ye plan say omo say omo aye omo approve am aye
in the say aban ka say o person ne mo tena say we go through condition of service na money aban da na sign ye no o free say nyoma bi wo mu ada bi we dey ye implement ya enye yi inti yensesa nyoma kakra are you open to such change
no na ye ka say sign ade no nyama nkitin bi wo mu no dey bi obetimi aso ano ato ansi dey aka won timi nso no e bi na wa ye den ya paper along the year e bi obetimi nkakra
okay
we no agreement but we can only accept that this is what sign document no
na say document
allowance no first na 400 cedis so say 1,000 from the new condition of service
me hu ha
but my theater is because of the court case no it's 400 no mutia and no say one time payment
okay
so social na utia ma wo mo a na de aka se bia neman kitin bia aka wo mo a was say Gabia, Ubetumi, Yanonka was not the Aka Wuntumi, no, ye Kasako.
Na say,
I would say, what your friend also about to negotiation via Marako, the condition of service, Ayaka, Abaya statutory document. Now, what's more implementing? Now, say the mobile cast, I think, yes, about the negotiation. You put regulations then.
Na say, a binder than a sign, a binder than a sign on behalf of the government of Ghana. I don't know where Muson sign be, I don't know sign be. Omon signs are saying, and our Munion Tumsa on be implemented, and I work okay.
And implement almost sign, the makers of signing now, yes, I know. I must sign documents under that, and not the completion of the condition of service.
Okay.
But the implementation signing, not the
okay.
Minister of Finance will sign and tell controller to start implementing
it. Now, may share one of the conditions in the new agreement, no, and it's a pay 13th month allowance. 1 month basics. Otemenka. Me say me who has say mo pay 13th month allowance, 1 month basic salary for all nurses and midwives to be paid at the facility level on a yearly basis. Naja anka bronya no mobeje salary mienu.
Anya salary mienu. Akwaya say your party say a token. Any ayibia wo de boa adwumayefo.
Oh yeah, me who say private sector no. We private sector companies be enjoy 13th month. In the no na kwaya say udru December ye betua wo December ketua na ya se ma 1 month extra.
Asana me
no. Ketua de aka ho.
Eti ya kama ntia se na adwuma. Da wontu me ntia ni nyina kra at the time a. E bia mama me nya di sei. Bia boso me no metin di atua mofa. Na kire me de fa aka ho. Ni nyina ya nhwehwe ya ya. Ah mutu me sign document na ke betumi atena se aye.
Oh, okay. Na eyi I think one thing in so more allowances now approved rate of allowances for nurses and allied public health facilities no is the allowances there acting allowance, additional duty allowance, overtime allowance, call in allowance, commuted overtime allowance, height and debt allowance no as such as say obi tintin 30 to 40 meters I was here to allowance obi tintin 41 to 60 meters I was here to allowance man
height allowance na ye ka no no enye se bia na otintin ne ye hwe
na mo hwe den
adwuma no bi o wa obi forosoro wa de metre no obi forosoro
okay
ana bia wa ye
okay
eno about risk wom eno asema na ye ka
where there into debt just
e ka ye beton pa bo tintin bia ma ye na se o ma mo ye tintin ano se be ya o mo susu o mo ko soro kakra
into debt allowance meaning say no say wadwuma na say ura asase ase a
debt eno nyina wo ho a debate on adwuma na momo ye no for instance obi electricity corporation na adwuma
yes
na ka ono ko propose na yi na me nurse na me ko propose na se ka height allowance ono mo benya benya bi afi me and applicable to me so dia na sense me nya no bi
na
for instance book and research allowance omo teachers kakra bi na wo training institutions yi mo eti mo kotia yet me nkasa bi am me general clinical clinician na me aduma wo no ya dey bra me because I don't qualify for that eti allowances no ba bi eko
okay wow enti yes I've seen it some very interesting way into more share even local trips now is it say conditions when new agreement we no na eni ho dada na se na wo ho ba na rate ne na nisa
yes sir sa ne ma 2020 yi num ne e ba no nyina ne ma ye tan bebre e wo mu dada
okay
so
yes
e ti ye review ye no kakra na ye dia ba be ka wa ya kan se o mu nye e na akwa ya atemi
na mo medical stuff in this nurse ni yare na oko hospital a e another na esi sisi what is the situation now
o say insurance ya maximum for me say 23 or 26 cedi yeah nurses and midwife no bosumi bia you tia 2.5% of our gross salary et you am say you lower kada no say bosumi bia the 2.5% or contribute to NHIA no e 20 cedis afi o tia 240 cedis na oyare not a facility kura owo mu no oye adwuma wo ho no okona na insurance no kura no antumi ankoba yare na nduro ni niam ye de beye no no a nsesa bi aka bo bi agete no ankasa kopesika e be hye ne ho ya be aban no hye no
eno no se temamufo no nso ko hospital na so we insurance any extra charge bia ono an de tua tiade na mo de ye different
omutia 240 to say you look at that.
And mumu kasa because of the premium na mumu tia na what straw no.
Exactly.
Any additional way be our san ka mo employer no efa ho ka.
Omo de tia even premium ya premium ni chata omo de tia. E the processing fee no nyina aka ya kotia no so ka san ka ho.
Wow. Me want me share the agreement ni mo na under medical subsidy no. Mo say employee what you mean ka? Employee, spouse and 4 children of 18 years and below to be covered by NHIS. Payment me say we need to just say anaje and mon stop car na kaka ye wi ana mato aso. Why? And no beboa. Ye ntimo park ya. Mo park car na ye wi ana nka mato aso.
Car no there guy to make package about fortunately say me come about kwaya and I say but ama manya kwan kapel
okay and the ginaye kakama ye o say employee, spouse and 4 children of 18 years and below to be covered by NHIS. Payment of 50% of the cost of management of illness not covered by NHIS. Refer to section 211 for the nurse and midwife. Where a child is above 18 but below 23 years and is still in school, he or she shall be covered by the medical scheme. When which they will breaking it down, what it's saying.
Man, the but Kakao Kanadia. I say 50% of cost to be a woman, incredible. And they are old one.
Where you old one?
They are reviewing 100%.
100%. I was say a buying effort.
100%, you know. And they are reviewing. I think or my time or my dear to my or implementing.
Inti maybe about the new one. Is it the 50% or the 100%?
I said network idea. I said, bro. Hello.
Yeah, hello. What's your name? Na me busa say 100% the new one and I say 50% no.
I don't know new man no.
100% the no.
I
say any illness NHIS cover no. E was some employer
no for the better bia no.
E was some employer no.
Employer no for.
Oh, okay. Okay. Wow. That's really interesting. And the momo de until say aban agiatum na implementation be shase no strike ne de mo to aso sa.
Oh, no ya kada da. Say road map ye kire say ja ye shase ya be boku jan na bia no na no nya ya be withdraw OPD emergency service. Ya no nya ya total withdrawal. It is not total withdrawal no do so. La more ensign my eye. Until some better idea. To strike an idea that you know.
Na amount for so free say nurse for Nankasano abaya jeje moswache dodo. Na mu school ye tua allowance mamo. Mu wie a aban until recently na mu automatic employment manya adwuma eye bibia ne nso anoma hold your mind nyina to ransom. Eno no moka ho dan.
I did not allowance now. Now you hear my no. I don't know about it. I didn't say allowance. Yeah, you man na. And then it's training no. Akra na to school kura through baby. I post na ko baby say koko ye adwuma. The tell mu go clinic I wo Ghana ha nyina. Enya ni mami fie na ne papa fie na okotena. Obe high dan obedidi. E ti say one man is allowance now. Obe there ye say adwuma no. Obe timi afia. Okay, a part of the training agreement on and the allowances no buy. And yet be a dati na mo koye juma na buy to simonanti na ya mama allowance in mamon kasa.
Na what so say aban ese omu put in place measures to mitigate most strike any impact benya on healthcare delivery in the waton safre retired nurses and midwives say omon saimra now, we volunteer any adwuma in momo absence. Mate.
Yeah, that's it. So, all model befa to be no working me so no. Now, Shamre wa for monko to give in am ko kitapuma. Obet me ko kurunipa. I didn't know issue na kasa solution no. Na mom pese mo beye na mo de for fan chen dia. Dia be ba no. E dia do mo se o makofa o ma ba. So so make me no mo kra mo do mo yesen and the mom put to public ani I didn't know what to say we onim and do one sign you bet me no about implement be on to me no on try to negotiate how to implement those I mean how to obey me instruct those I just simple I won't go to now work I resolve issue no dia say there baby omo ka so omo ko strike no bi omo de ete wa eno nti omo fees omo betimi aso you know omo numbers no ne ye dai gu ho kakra yi ye nyina ye hu tama ye nyan da total you can OPD and emergency you know not my no to say eno nti sa nya say ye de so ko so sa ba wa ye say o fi ye de ya ye fi da sa ya da maninka o ja maninka
na o se nurses retired nurses no omo ye merewafo omo nkoto dwe nyina ewu obi kitapuma obeda kukuru obi
Sempa FM
na retired nurses no enye omo nyina na ye merewafo saa o
Oh, make us say, oh, money now, Krabomo, no, Munyamri, was all Modo do I say.
Na nurses over 120,000 no omunyina na members of Ghana Registered Nurses and Midwives Association.
Oh, I know the market. Yes, GRNMA no. Yeah, 96,000.
Amumu ya 96,000.
UPNMD ya 36,752.
Okay.
Others no aka kuonketenkete na yeka. Omonso de ne de aka na omoche.
Na UPNMD no omonso omoka strike we ho.
Omoka omo na se omo nkobi. Ebi omo ni other four ni nyina apart from GRNMA ya 5. Nka ya 4 ni nyina se omo nkobi.
Omo de omo ye adwuma.
Omo se omo ye adwuma nti omo de conditions no a omo members wo no eye ma wo mo nti omo follow due procedure. Due process. Eno na omo ye no. Se eno na message ada be ka se sa procedure no kwa mo follow no. Ya fi ye nyanka ti capture ada no kwa in the budget. Eno na ye hu ya. Eno ti ye ko ye strike no.
Anti GRNMA no mo na mo doso.
Yeah, 96,000.
Hey. Enti Bosumi June we no. Say we your friend is saying total withdrawal ne started 9th June. Nra. In this enti asia anya adwuma na mo strike ni mo to the end of June a. Mo hwe nim say aban betua moka.
No, never law no my kwai say aban ntia ka.
Hey.
Never law no o ma ho kwai.
Asempa FM.
It won't even cast a work of strike into me. My we hold salary. No.
Na sika bisa no mo je a mutimu mu amofo.
Ye dream wire for allowance is okay be no kra bro no.
Ora krampa mayena se ye da se pa. Now why a nurse for how many years ni?
22 years ni.
Hey, 22 years as a nurse.
I 20 years mu na me we.
What rise ya but is a senior nursing officer na.
Then kasipa.
In the for 22 years what's he dying when you assess he dying?
I don't know ye kano. Say that allowance is in na beti na boaye. Ama ya bibi. E no ti na mo na dey follow kwa bruchire no. O ko pesi ka be fini dying. Ato me ka. E to me dey me wo dey me ye. But ni na free ya kati ya ba dey ma ya no am.
Na
say ye mo binom ye we investment ye. Ye mo bi mo ta ya kuafo. Ye koko kuafo bi mo ye poultry. Bi mo ye sei. Anti ye timi but yes ha sika abai de ma ye no hia.
It is here who your nurse now only source of income ye abaya ketua ne de a untimi mfa mo bre.
Oh ne de kwa eduru me.
Into until sir mo be negotiating new conditions we no na nurse ni a say over adwumanim for now starting from the basic level na oje aketua entry level salary ne be saying.
Oh, I don't know the main who outright in can. But I think it is between the gross one is about 2,500 thereabout. And when you have to take tax free.
Nurse Nino.
Aye. Yeah, no man for fee say you will seek or go high dying. Then what you advance very 2 years. Or the next year to say. Every year class say na onya obedidi. Say na onya ase buta me ko ta. And then of course our microcredit and whatever things are. I can net for a door to womb. But I want to make it ends meet.
Omoje bosia wo hopa.
Aha, now it's in kakran. I said they are. Or bet me I never be
Hey, in the entry level no 2,500 ne kwafe ne ye betete no. Into obe wie no wanya be 1,008.
Na ka be 1,008 mo no me ai.
Hey.
I don't think I yet to my before. Monsorin Catantra Bano. Now I prove you know that. Yeah, Duma. Yes, I want to tell you that. Get the background so I also the Mayans know. Yes, the member my own society.
In the entry level, no, yes, 1,008. By the time I'll be do senior nursing, no, now is a ultra 5,000 impo.
So I will great beyond a salary or more.
Yeah, that's what I'm saying. In Tibia, I'll be do senior. Yeah, what you mean, ka? Me was say from entry level, over rise here, drew be senior nursing officer, for example, no. na woje be 10,000 ana
what's 10,000 baby 10,000 say
hey
not deputy chief no me a further deputy director no me say no moje
hey in Rubedu senior nursing officer na woje be say 5,000 and I be 4,000
and there about
hey
and okay new papa 5,000 something 4,000 to 5,000 something and so you take tax salary a monthly salary nankata
oh and this was senior nursing officer and that's what the be 10-15 years were you mean
10-15 years na kati ya na meka tell monthly you know yeah mon check it from further money control account mo be levels ni na they will be aging
Entina nurse for ton parazone in ro ewo ward.
Well, once the kids are means now, won't even survive the system.
Hey. And they have some kesio. Wow.
Na yan kitchen kitwa yako kamuna. Mon sign and also mra. Na no sa kwa ya sem foforo. Kata o mun ko ya ejuma. Ejuma no ye dia go.
Ora krampa amanfo kra ka say mo position we am taking no e be kra ban pam mu nyina na yemfa nurses for adwuma
yo okay on pam ye na say on pam ya ye continue
asemo ora
ka wo say o be sign na ka be 2 point something billion in it o be pam ya me yanko
Joseph Krampa me na say
na we omutu kwa free mind mo ko ba bia wo ka kire ye say ye ntafa nkire nkwara no o betime di we atena se abobra wo Ghana
na se se ampo de aban actual koma UK authorities say e mama Ghana nurse bi ama ho say wate
na nkwa na omukọ na omu sia German ka sa bi mu ka French e mu ko areas anya nkwa na nipa ko
Joseph Krampa say o kra no say akwan ni bie na kra obeja ye ho akọ
oh say me na kwa nka me ko dada me ma na be ko dia wo dia mebo a o makọ
o mo nya adwuma wo krom ha
o say
o mo nya adwuma wo krom ha
oh da bi so mbe ko dia ba bi nse o mo ba so mbe ko dia se o mo ko o mo hwe o mo daati so je be 2,500 be tete da be na be timi abeli ya wo bi sa se dan ya sidi
Ora Krampa me da say ye be say di nko
so me da say bebre bye bye
yeah so Joseph Krampa a PRO the Ghana Registered Nurses and Midwives Association Charlie but nurse for us me some kesi we am imagine say we entry level nurse ya posti wako wase kropon because mining ewo huntino nioma boeden kakra. I was even told say insuo auto bottled water nketwa no sachet you can say park ne baako do me akra say no bottled water nketwa no park baako say 25 cedis onum say wase kropon so mo say be 40 cedis o yeah 40 when you for cry 30 something in is how your nurse wo and a honso no mining ninti single room a way no ane toilet and bath went to acquire 500 Ghana cedis in the entry level OJ 1,008 that's your take home na ya de wako wase kropon obi anso uji 2 years if you re bia no obeje 6 months and 1 year 2 years na just a wono from the get go no waso be share wa adwuma ni mu anti oba word obi a obuafu obi anya ohwekra na obuafu eye nsem a wo se ye hwe na ye ka ho asem let me go through conditions na me boboso no na munya a fair appreciation of what we're talking about omo conditions na which them a omo ne aban like omo signing off omo hwe se it would be implemented into uniform allowance payment of 1,000 Ghana cedis per year. We know a one-off payment. All nurses and midwives in the public sector ebeje. Fuel allowance. Omoje 180 liters at the rate of 10.99 Ghana cedis, or at the applicable government approved ex-pump rate, whichever is higher. You know. Ain't we for principal nursing, midwife, and as a midwifery officers in the public sector and above analogous grade. And no. Omoje non-basic allowance 8% of monthly basic salary, where to all nurses and midwives in the public sector. Omoje on-call facilitation allowance, which is 5% of monthly basic salary. Nurses and midwives in the public sector who work in understaffed facilities and are required to work beyond the normal 8 hours. Rural incentive allowance, enoye to be paid as contained in the final document prepared by the technical committee of the Ministry of Health, and also nurses and midwives in the public sector who work in rural areas. Okay. And the NIAD home komo 13th month allowance. In the announce here 1 month basic salary for all nurses and midwives to be paid at the facility level on a yearly basis. Okay. All nurses and midwives in the public sector ebeje. That's a December no. Ombeje, 13th month at the account. Continuous professional development support. And also annual professional license renewal fees and required continuous professional development to be paid by the employer as contained in the collective agreement. And in this agreement, we only use employer biano na your government of Ghana. And the American, your project a live stream is into Uber hu YouTube, agreement and the details thereof. Nina you just join us on YouTube at Sempa 94.7 FM. And when so continuous professional development support na all nurses and midwives in the public sector. And I war your friend is saying let me see. Okay. Into night and out of station allowance there were foreign trips, day trip allowance, or more book and research allowance for nurses for na extra. In fact, funeral grant and so funeral grant into employee ewa. I think 2,100, spouse 1,400, child 1,400, all inclusive. Okay, in the way of funeral grant, I don't know say a employee who and I said the year, but that's what's here. Employee 2,100, spouse 1,400, child 1,400. In the Nina agreement where your money are buying, assigning on to. Tony Goodman, Ekasa Emma Ministry of Health. My no any enkomo. Tony Akwaba net saying Adum ya bibia boko. Nurses no are clear in their mind say the only thing about a quality of strike no is for government to sign onto the implementation of what was agreed between the money government of Ghana in 2024. Besides that, in the Nyadi Ombeji Bibia Atum. Mobile and the dance is here.
You may dance a little bit. Position as a giant of more free. I mean, yes, sure, the best. So, upon the definition, I was who shared both sides. I think, much more than I started. Any almost something, no other minister of health, no company, extra, and only you want to say a bit small committee that's one much as other documents. Now, just the better. They are bros one, you can't, you can't. On so that would declare transparency. On would declare strike in the crown, oh, yeah, at home.
Yeah, share document. Never need to work. You bet you the local arrangement there. And we have to wait for the whole implementation of the document. And now I'm in charge here. So I propose that I'm going to ever for a meeting. So that meeting, fair wages and salaries commission in the fair. In terms of the abandoned proposal, which is the document we are signing 2024. More court. This January, February, and I'm going out of court settlement and cut budget. Into the best thing going forward, man. I say that kind of a serious year, and after next year, into not next year, your budget and not next year, just started this year. So about near friend of the arrears, now I started on the however, documents I was a 2-year lifetime. But you make it sure, sir, you may see this across instead of there 2 years now, every day new documents now, ever send it out 2 years. And I'm also proposing, yes, sir, I'm already implementing to see now you're arrears and come on. But we thought that it was a good negotiation. What present to the Abaya into the quality of strike. Show me the quality of strike. Now you're short back and forth. Because at the end of the day, Ghanaians are suffering in a hospital. And not see a young administration, your major concern. It is a more table proposal, young table and proposal. Young quality of strike. Now one continue discussing. Only for us to see in the media later in the news corner. We have rejected the proposal. The strike will continue unabated. Not the ministry, what can we do? We can still call on their conscience and see whether that is possible. Yeah. Now, as I said, we go to the aid of the people of this country, of the suffering that we internet was there again. One people work where one for crash. And I present retired nurses of motion, back. Hospitals work me moving and you better announcement you are changed the all hospitals. So they are Australia. And I said, the big two grand wouldn't say hospital be one on go the street. Yeah, the number down. Which will be another pan and
hospitals, they public hospitals and are private.
Ghana health system, a public, private hospital, quasi-government hospital, Christian Health Association of Ghana, teaching hospital. Ghana, Ghana as a health system. And see, that directly where to get which care. Because, Ministry of Health, the effort that are putting in place all over the years, the target is to make sure that the gains that are here, the rest of the state, also the maternal care gain, we need to maintain. In Kola and the 5 and the 6, we need to maintain because my number 4, things for the hospital, for the hospital. I was saying making sure that your mortality rate will be reduced.
That is Tony, who kasa through earpiece and
I think so. Is it okay now?
Yeah, it's better. It's better.
Okay.
Yes. Now my question is, is it a fact, sir, this condition of service I can once May 2024, and at the government of Ghana, any nurses is signing on to this condition of agreement, condition of service, sorry. Is it a fact, sir?
A document, almost signing in 2024 May.
2024 May. Good.
For it to take effect in July 2024. Implementation and can also start July 2024.
Yes. And I almost say there was a court case against the implementation, which case was resolved in December 2024.
January.
And a bar said January 2025, the implementation should be done. If
Bobby.
Yes.
December, January, you know what happens in Ghana. There is a transition period.
Absolutely.
And I don't know who gave that indication. But there was one revelation that was Ghana phone to during sad negotiation it came out clearly, say, employment transition team it desires, is there a condition of service that has not been implemented during the transition period around January? Yes, there is no document like that. There is no condition of service that is implemented yet. It was clear. Those who were on the employment transition team, and now they said it. Until now, it was lost on Ubia because the larger document and after the bigger document is saying that there is nothing like that.
Is it the case when the new health minister took over, our nurses present a copy of this condition of service to him, the ministry doubted the authenticity or the existence of that document? Is that the argument?
Obi, even that period, what actually happened was that, the minister was actually inviting various unions under his ministry.
Yes.
And during that discussion, there were other things minister separately. They are happy with that arrangement, a local arrangement, even though a year condition of service. Or no, you see in the local arrangement a year. That was when he got to know, even what he was doing, a part of a bigger document. Then he said, okay, move a document, This for the minister, what he has to do is just transmit that document to finance. The document need to finance, And when who say there are things that this document and after there are procedures you have to go through, which is fair wages. Fair wages, it means that we want to renegotiate the agreement. So, okay, from the beginning, almost say signing.
Yes.
We are now implementation. Signing. So we were also saying, it will be better for us to see as a team. Then we see, signing document, when is it taking effect? And it wasn't as though the document went through phases. And now we got to a point where we said, this document must actually be looked at. Now we said it should take effect next year because you threw a surprise on the economy, threw surprise on the budget. Now your economy has a trigger. So let's look at next year.
But in all of that meetings, was it made clear to them, say, implementation of this document, mean factor into the budget this year? Was it made clear to them? Because they seem surprised, say, and omote from the finance ministry say omo fan share budget nim. They seem surprised. And was it made clear to them say it cannot be factored into this year's budget?
Obi, it has even come early to them because Omone, the Minister for Finance, meeting 18th of June because they are not in the country. They left this country and they will return on the 15th of June.
Yeah.
I was a meeting on the 18th. So this announcement has come early.
Okay. Who are not in the country?
The president and the secretaries and other executives are not in this country.
No, I hear all the executives apart from the president and the secretary are in this country. President and secretary depend on Geneva. Omo Makanina are in Ghana. That's what they've told us.
Yes, the way they operate,
yes.
There are people who they don't take any decision. They have to go, like what happened yesterday.
And it will not make any sense really to engage executives now without the president and the secretary. That's the point, right?
Obi, when they went to Ministry of Finance,
yes.
That was the indication. So ILO conference. This day into the meeting into this particular day. It was the Minister of Health even who inquired, and also Minister for Health, Finance, after meeting, but the minister gave us 18. We are not happy with it. Then the minister said, I would have gone to arrange that meeting for you because I keep telling you that I am your chief advocate.
Yes.
At all time, I can speak to my colleagues. Oh, I beg, meet this my people small for me. Then we are moving. But if you go behind me and go and do that, and now come to me and come and frown your face, say, Minister, I'm 18, so I'm not happy. That is not fair.
Okay.
Then we got to know this is what actually happened because they were all traveling. They agreed on 15th. When they come back, the 18th, they have that meeting.
Okay.
I know that before you know, but
you are saying, sir, it was on 18th June meeting, you know, and Anka Finance Ministry, Ebeka Chro, say, yam factor conditions no in this year's budget. Sana Oka.
I am saying, sir, that decision would have communicated the decision on the implementation of the condition of service. No? That meeting, and they would have known what will come out of the implementation or not.
Yeah, but I'm saying, sir, in the earlier negotiations, after the minister took office, they went to him, presented a copy of the document to him, and also the Command Finance Ministry. It was way before the budget was read. I'm saying, sir, in all those engagement before the budget reading, was it made clear to them, sir, this year's budget cannot capture more conditions way? Was it made clear to them so they would understand? Because you see, they seem surprised, say, and then the team say ministry is a man factor in the budget 2025. And I'm saying, say, before the budget was read, was it made clear? Because the minister tells us, he had engaged them for some close to 6 times. Was it made clear to them, say, having gone through this document, we don't think we can implement it this year in the year factor into the budget? Did you make that clear to them?
Obi, and American say for us, we will transmit that document to the appropriate authority and receive feedback. For us, we will look at what local arrangement can we do. Say the be a woman, and I'm saying, sir, at all those meetings, the Minister for Health and them agreed on certain arrangements, even though it was our document, and we had a local arrangement so that even if the document is delaying, it affected the other ones. I'm telling you, there was something that happened like that until it was after the budget that this whole thing started. It was after the budget that this whole thing started. We have to be included. Yeah, it's not included. Let's push hard for it to be included. July, there will be a mid-year budget. Let's go and push. So this is what is happening. There is a budget coming up. So let's enforce here into your conversation.
Yeah, but what's wrong with that? If they have that position, say, rather than somebody be called next year, there is a mid-year budget review. Why don't you put it in the mid-year budget review? That's a legitimate call.
Obi, I shouldn't behave as though I'm an economist. However, I will say that if I put it in my budget, knowing very well that this one is not going to be on it, or it's going to throw my budget off here, where my resources will be coming for to take care of this budget, I have not even met half of it. What I'm seeing, the budget I'm seeing, I won't be able to even fulfill all of them. Looking at my income, why do I even add it? So that is what is happening. If I add it now, my inflows be able to settle this bill? Next year, I have projected that I'm going to look at this. I'm going to get this money. So let me put it. I think we, as a country, we should just accept this good deal because we know where we have come from.
Yeah, but they've also made
with this economy.
Tony, they've also made the argument. They've also made the argument.
Economy of gear again.
So they've made the argument. If they were in the hospitals working, and I am funny say there is a crisis or a disaster in the country, I was a buying a health disaster. I was a buying raising 2 billion Ghana cedis to deal with that health disaster. And that's the argument. So if the state values what they do, the state should find the 2 billion extra to sort more issues out. What would you say to this argument? No, Musu put it forward.
No, they are entitled to the argument. But when it comes to the if if. You do if here. Where we are now is where we are. A decision being taken today, it's because of your father said what we know. I can tell you, sir, Osha schedule now, Osha conditional service, ne schedule na you know, A and B. Old and new.
Yes.
Nyaya can once me, and you say, a bit new by the increment, and I said the review, no,
sure.
And once them na can say,
sure.
But as it stands now, we are paying conditional service, but there is an increment that was each year. That is where we are.
Yes. So the new one no, is the subject of this whole strike. The new one, no, which was signed.
No, I just want to also make this point that the conditional service we are paying. Yes, there is an upward adjustment.
Absolutely. Yeah. For now, two sides, no, because government has made it clear. Say, for this year, it's a no. There is no middle ground as far as government is concerned. Omonso say, sign. You just sign, and in the implementation, no, we can see which one should be done now, which one should be deferred or staggered. But government says for this year, no, right? Those are the two positions.
Obi, that is not the
okay. In the government position here, then
their position, it was supposed to be to review the document. But documents, we will implement it the way you want it because most young implement my share document we should implement. So okay, we'll do that for you. But looking at our budget now, it will be proper. We do it next year. So I'm sure, sir, there is some what do we call compromises here and there.
Okay.
Yes.
Okay. But they say next year, dear, no. And I'm also say it should be next year, right?
So halfway. What have they done regarding this negotiation? What have they done?
The PRO just told us, sign. When you sign, they know, government may not be able to implement everything in the document, but the ones that can be done now, do it, and we can talk about the rest on how to implement the rest, and so that's the argument.
I know some moral way no na menti I say me government I sign and then I implement it. I'm telling you what I can do for you. Who say me dey sign it? I'm not sure say it's the best. Maybe there is something we don't know. Say they are signing and they may be paying it from their own account or something. But if I am telling you say me sign here, make Chiana is the who say no who they sign it? I know you can pay. Just sign. This argument.
Yeah, almost
we must sign and implement.
Yeah, they say sign, implement what can be implemented now, and let's look at the ones that we have to stagger. That's the argument. Yes.
Which means hospital be a war ukum, say a health center, a chief's compound. Who say workers a work on by December no sa hospital also or more 13th month.
Yeah, in this new way, sure.
Is it possible? Would be say the hospital in your hometown and I may be cool health center. Me, my hometown, we can't pay. I'm sure that yours will be the same.
Yeah, sir, and I'm say it should be borne by the facility.
Exactly.
On the 13th month, let me read it. I'm gonna say 1 month basic salary for all nurses and midwives to be paid at the facility level on a yearly basis. That's different. Is it the same? Say the facility should pay it.
Yes, at the facility level.
Maybe government can advance the money to the facilities to pay it.
The facility must pay
from their ID.
This one we know what the language in the document we know. The facilities must pay.
Asempa FM.
Okay.
Yes.
Yeah, but the government of Ghana signed onto it.
Yes. So government of Ghana can also say that that agreement I want to renegotiate, but that has been shelved and we are looking at its implementation. So I am also hoping the leadership of the nurses will also meet government halfway, and then we'll look at how best we can go back to work, take care of the life of Ghanaians whilst we continue with this one. You see.
Tony Mianase, Bibiani Ebesera Bidin Komobio.
Obi me that's pa.
Tony Goodman, Ekasa, Emma Health Ministry, and Amoten, and Ekosiisen Suni, a higher Sempa, 94.7 FM. Really interesting stuff. Or Adrincha 0548 443 523 0548 443 523. That's our WhatsApp number. Come through with your messages 0548 443 523. Where's the Obi? What are the reasons for the strike action? Overly delayed approval and implementation of our collective agreement signed in May 2024. What are the demands? 1. Approval of our collective agreement by the Ministry of Finance. 2. Implementation of the collective agreement by the Ministry of Health and its agencies. Priority items needing implementation are CPDs. CPDs near the new rate of uniform and fuel allowance, book and research allowance. The implementation of other items contained in the collective agreement can be staggered. And that was the point I was making to Tony. Into Nyomo Muchemwa immediately, so I sign we are immediately or implement CPD. CPD is near then Nipa out the message we buy, I'm powerful. I don't know if that's your name, but let me know what the CPDs are. But it's a new rate of uniform, which is 1,000 Ghana cedis, one-off payment. 400 was paid according to them, and the 600 no more share. And book and research allowance, then so are the immediate ones, and then the rest can be staggered. Those are omu demand or what Tony Goodman calls. Say, what are they also doing to meet government halfway? I think this should suffice for that. Where's Obi? You see, the government sets themselves up. The government wanted some respite by pushing some major promises and negotiations to the budget reading. Obi, if you say this, then they say wait for the budget. It was as if the budget was a panacea to all the problems we had then. The call by the Minister of Health for retired nurses and volunteers to step in is very ridiculous. I think the minister has not come to terms with the fact that he is in power now and not in opposition. The Ministry of Finance will have to act swiftly to support the Minister of Health. Other than that, we will be doomed. Godi is in Tema. Mayankwa Homaniso, Doctor, are you a free, a ranking member on the Health Committee in Ghana's Parliament? Doc, Ekosiisen Suni Akwaba.
Yeah, we are only major, so let's say
na apomu ye de yeah na any nurses and midwives strike in nsemo a eboboba minority members on the health committee moje ne san me pacho
oh yeah, your press conference so the first aban and the nurses for no ending year because at the omo every January mama komo so omonya dia aso mutiom sa oba
FM
nurses for no wa ni omo kasa no omo kan the Ministry of Health and Minister of Health dia on wire dia the finance dia omo person be more approval I mean so dia there health and finance I mean the minimum difference me dia no say ya buy to when the posture is not good, it's affecting everybody. But minority, your posture is the nurses, harmony a bit merciful. Na demands need here. It be 8, Nina this year. But I buy for better not catch on say, yeah. Nursing allowance, the mammo, research the mammo. Na Niakano, next year cycle. It's a play the answer. No other one, yeah. And no crumb can sanctuary. And now also nurses for us alone. The woman say, a bamba quick tribute. Omudia ye at the side. Me, I did to say, the baby be a mamma. July, effective 3rd July 2024. Kofi and Twitter, and psychiatry nurses for Omwade Omones in the court. And by into me, Omufi court, January is not about Kufraba. But when the government, governance is continuous. No, there's a dear on found no MPP are buying and CPP are buying. They are buying back or buying back. You dare to say, you're right in here. Monya Maye. And I think January so moving your moye. My understanding is that Omo catch almost say Finance Minister this year or June 18th. And almost feel that. Na ye be ya de na mo be ko ya mon ko ya
But to actually 6 months. And now my nurse for the go through. The nurse for here. You're right. You're more prepared. You're right. And you're not yet started. And come up for your submission there. Yeah. Changes someone said now he's at the ship. No about the ship. And I rule maybe your nurse up so called and then for a crash in your group. Your post to also in Sikaka. I will bet you can over cobbles me be at the mouth. Yes, I will bet it. Okay, let's make it. Are you okay, Obi? Are you okay? Only say, I'm a papa. I'm a property. Oh, and I mean, me say, did you say, unless it's one of your politics? Politics is saying, perpetual your presidency. I'm with the MPP. On one perpetual, on one at 2020. For cost strike 3 weeks, not fair wages for penal. They caught someone, no more. Not that time, then the people. Indeed, I think we should move into those realms. I think a realm of absurdity. Let us get focused on the issue at stake. Or the dormitory, or would you was said, or Chong say, but when Obi, the end of the in the press conference, Omoya assertive too much na amount for war. I said, be a do second in Amau. I don't know now, Benya or Sadi. Internet for no. Yang the Jamuchi, MPP for your support, they're more right. And so, chop on the mom said, a buying boom, no, no, Muxasia, Madaroma. Yamano, more stagama or na Munkwejuma.
Okay.
A buying boom will be added.
Doc, a buying so say Omonsa can. In fact, there are two issues now. A PR of the ministry raised. They say even at the transition health committee meetings, Omoya transition meetings in January, nowhere was it mentioned. In fact, there was a question asked, say, is there any outstanding condition of service be was a new government implement here now? They were told no, there was nothing like that. Later, next for you among new condition of service, the minister also forwarded them health finance ministry. Omushe said no.
Ministry of Health PR no said you can the ministers are raising the boss from January. The way our handle nurses, yes. The nurses are on a cafe announced for any more than a year. What about one thing about the cafe? Nurses for no more in Town in January. When Chassis will be almost
one castle Muninki Tahon. Or say Omudinki Town makers or say more transition me. I don't know, so now health committee, transition health committee. Now we need to go. And you almost say in that meeting, they were not informed. Say outstanding condition of service be or was Mubabe implemented. They were not informed. The only time they go.
If you were informed.
Yes.
Informed.
Me too.
If you were informed, what would you have done? It was out of court only on 25th January. That was after handover. And if we were even informed, what sense would that be? After appropriation bill.
Doc, wa homa ne munya crowd, minim.
Hello, Missy. Missy Obi.
Yes.
Obi Ukuminka.
Metuka.
Appropriation bill. Yende ya appropriation bill. What you say? And you want the appropriation bill. Appropriation bill was done before 7th January. But what you say?
Yes.
And even if you were informed at transition, what would you do? Because they were in court among themselves, the nurses.
Yes.
And then the stall implementation. They came out of court only on 25th of January. 25th of January, then a new government has taken over. The only window more to solve this is a media budget review. But what are there? In the media budget review, and there was a finance for no cafe. Appendix B of the CBA, Link me, Yamabaya 10 in there, but only be a tremo. My 1 and now 2 or 3. But you have not given them that thing. So what we are saying is that the government has not been fair. In the media, minimum health, I mean finance. For health, for no, nurses for ATM. The one I'm okay, I must say health for no minimum the finance is issue. But me MPP and the me whether it's finance or health, media boom may buy. I buy anyone. So what they have to do is that they have to sit down with them and then just agree on what they can do and put some of their concerns. Luckily, no media budget review, no. This month or next month.
Yes.
Then I show them say, oh, at least. So then, nipa and the kata. So I let the for TV. The mekan is there. Inside the inside. Put the jibu form. Then she got enough with. That's it. I buy no most national more kasa. This is more giving to no more how more by now more come back to work. But for now, the government has not been fair to the Catholics. That's it.
Yeah, but almost say renegotiating the terms of the agreement, Nidia, like the content.
But who can do that? Who can do that? How can you renegotiate the terms of their thing?
Yeah.
You see, the government who is saying that? Sorry, me Parliament may a statement on this issue.
That's fine.
They should renegotiate it.
No, initially that was the post-train of government said they have to renegotiate somewhere, and then later, Abandeka said now no renegotiation, but implementation cannot be this year. Yeah.
They should listen one of their own, an experience. It became one of their own. Austin Garment, the water.
Yeah, Austin Garment.
Yes, he has been a labor minister under NPNDC before.
Yes.
And he is now a consultant for everybody. Austin works as if he has no political coloration in his life.
Yes.
Clear expert. Omunti Austin, so Omunti vary their right now. They cannot vary their right. So why don't you just plea with them? But I I'm not ready for Obi, and I don't know who is going to die next. Mind you, be a politician, but be a medical doctor. I'm guided by my ethics. There's no joy in doing politics in life like this. I'm not interested. And minority forums, they're not interested. We stand by the nurses, but we just want to play with the nurses. That government show them respect. No more financial. Let them do something about this for us.
Okay, honorable, you better say, but I get the way from Tony Goodman position. They say, Abain say they will not renegotiate anything by implementation. The intimate this year, it cannot be this year.
I know it's been too assertive. Obi, go and read Thomas Kilman's theory on communication and conflict solution. When you're too much assertive, now you're assertive, but more lives will die for no need. Abain fostering should be to cooperate with them. They have the power, but they should take a more accommodating posture. Not Emma necessarily for us taking a more cooperative posture. Now, almost and trading off some of their grievances. Now, a peace of mind. Not trying to be so assertive. Going to court, bringing temporary people to work, returning it, it is not good. It is not good. I don't think this is a posture. What is there, Obi?
Yes.
Obi, na me no kwai while standing to.
Bebre.
Won't to me there no. You go pacho, mama your platform, you pacho, you ready.
Sir.
John Mahama, oh, yeah, President Mahama. President Mahama, you about the cockroach. President Mahama strike ni mo mudi, I want to put come on next, but still have the cockroach.
Na tell pa no be open sisi a obetimi apache no. And I'll plan
that's why me determine won to me eba on me no me na kasawati ase e di mo my slot on my short time eba
ochina you are allowed, you are welcome ochina.
Yeah, and you welcome. You be president Mahama Cho
mate
na fe di aban no enya botrema won to me ma me no kaka why this year president Mahama yam president goes na service strike ba ochina ba dia ajubrel why
material yeah that's papa.
Thank you.
Dr. Nana Ayew Efriye, or a ranking member on the Health Committee in Ghana's Parliament, and a Moteziano AD and Como. Ekosiisen so higher Sempa FM. Unim say and a Meba studio, and minya call free minya Kofi Tonto Kofi Tonto political aid to the former vice president. Now, or the two menim say on any new bar. Ninu aba panyi indi Kofi di nachi mienu indi akwere se ono nachi ba mienu eni Kofi Tonto ninu aba no nyame aton safe ne ewu Kumase enne na reason ne ye friend saying hospital a omode no echinche bebi ombe ko bia na omose strike in India also omode ne ko ba before fro eventually omode ne drew private hospital occupy arehwe no na nyame ato nsa afre ne nuaba nti make say kofitonto nuaba panyin ewu ya hosem papa nya asem ketwa nti no ne de esi anope a wo se ye de tudwa na munyina mutibi. It's a sad news. And offer me on the phone, he was virtually crying. I was say utu na mo eko Kumase sisia enti a nurse for strike no enya asem ketwa. It's a serious issue. Ma yenna ne yehu ne yentie we mra ye ba. There are a couple of interviews ye be near the discussion segment no. Asheshes na mo messages ne nso me kan bebre amamo. Unim say nurse for strike no ehho asem kra no aban enkanwie na ade ba kon so university lecturers eka omo ho a yenim book and research allowance enei enra UTAG for a meeting enye UTAG nko in the UTAG TUTAG SETAG in the UTAG near University Teachers Association of Ghana TUTAG near Technical University Teachers Association of Ghana. Emma SETAG no Colleges of Education Teachers Association of Ghana. NA almost book and research allowance assign ababio. Na omonso de atudwa se aban anya nneoma ba ku mienu bi ama won strike action bi omode ba be simo no. Esin krui. Inti meba ba be kan omo statement no amamo. CC anafi who said the neoma ABC ako and Martin so say in the Maka TUTAG, SETAG, any UTAG, and the Yaka Ghana Registered Nurses and Midwives Association. CC Mortuary Workers Association and so monso wa semka na enam nurses ne strike since omo withdraw OPD services to enroll omo withdraw total services no nipa ewu a edi omoba much na se wani ense wo kache Richard Kofi Jordan general secretary ma Mortuary Workers Association of Ghana Oro Richard akwa aba te saying na general secretary wo ye adwuma wo mortuary ben wo mortuary no wa Accra na wo Kumase
me ye adwuma ma me adwuma no wo mortuary office.
Who were office as a general secretary?
Yes.
Okay. In the Musi nurses strike and now watch here. Nipa bebre wu. Since almost started to withdraw from I think 3 days ago. No. Yeah, Enra.
Yandra, who said there's a search, and I said Nipa ewu. I know ya cost FM. It's a cost one kasa. People are dying more.
Now, when across the country and as some specific hospitals?
Across the country because who ain't said a name crime. I was said a name Kumasi. Baby, I'm mostly a we are recording high death.
And for mono, you would attribute a high death to total withdrawal and NYC, you know.
Exactly so. The only say nurses in Nihua. That's the end. And I be bring to every year because what about the bring to the fact say almost yeah hospital nurses and many of the cases are coming from the house instead of say a big hospital. So as a matter to be in the hospital. I return free hospital so ba much ya esu na almost me say your hospital almost yenko yendu fia na nipa ni wuye. So those are the stories we are hearing. In the argument you withdraw the message na after
is there the stress about the tomonso
exactly
muso
and the pressure appear so one you na track list to Africa crack. Why I will be telling you so much as I am anti who are now they are called police station.
Now who are basically in the Paraco police station?
On as a police, so what is their mandate? Or mandate there to protect law and order, maintain peace. Are they to me in Krane Bay or Samudia? Police won't come.
Now, Ebushambia, Uniperu, and out in the police station.
Okay, report this. A jammy in your diabetes, what that will pull much Emma and Timunso, my answer.
Wow, but this is a serious issue. This is
this is a very serious issue. In my personal view, we shouldn't have even gotten there at all. It could have been prevented. The woman said, will be a problem.
Yes.
Or did he say, was signed documents? And per the terms of the document, after 2 years, we have that document, I not them voice.
Yes.
I laugh.
Yes.
And I and now 1 year, whether it is government A or B, Nipa no was signed document, only Ghana government has signed document.
Yes.
There is nothing like a signed document with NDC or MPPO. So they have a case. Until the only way of making a judge, I didn't know a document in the home. Move pay budget. Mostly I'm fine share budget. You don't take people for serious. You can't. As part of the compensation also they come home. Very major items. Because without the people who want to be Jumano. Want to be Jumano.
Yeah.
Yes, so only for last week, your National Labour Commission. Yeah, much before.
More true workers, so.
You declare strike here.
Now, Moko, National Labour Commission, Moko, there be issues starting last year, no?
Okay. What's the commission media? Once I want to notify some years past, no? Say, after the seminar ends, they will continue to invite you.
Yes.
To make sure so the man will report. And I say, come and tell us where you have gotten to. And the seminar saw, and fair wages have to intervene. And we must send a letter on the shire. Anka, it is not necessary because Ushanyama any the impact we even have on the economy now, it is insignificant. But Mubekans are way enough in the way people are sponsored and NDC and the matter Munda's idea no. And face the situation head on.
Now then, more trade workers, no. Say more conditions, no manya improvement kakra woman.
Okay, say improvement kakra. What do you mean?
Oh, some meaning say last year or last 2 years. Murezi issues
or last 3 years.
Yeah, Murezi
or
issues
last 4 years.
You raised issues about more conditions, no? Or man, you will be here.
The result is that's improvement. See which way? If to me prove it to me, say I improve it there. I will be able to okay with you.
But I'm asking you, sir. You raised issues about your conditions. Most threaten strike action near the and I'm asking, sir, following sir issues are Murezi, you know. Abai anya hu bibi amamu ana.
Amu ya hu bibi, but it was not enough to at least make us relax for a time.
Oh, okay.
You know what they were doing? They said they were doing it piecemeal. Amu fa we are no more na no more do implementation stage and no be agane.
Asempa FM.
What they say?
Yes.
That is the challenge we have with the employer all the time. So see, most is for a declare. Imagine say the kahwa. Say the everything system no.
Yeah, it's true.
So we are want to do it for human being. But see, when is the Minister of Health?
Yes.
A corner oko up and down in it is going to go against the taxpayers' money. And I need a free.
David.
It is going to get against you and I, a tax minister. We are going to use it to fuel, to ride. Well, everything that will happen, we are paying for it. And the year do by saying, listen, your conditions here are fine. Try to implement. Also, okay, my setting up committee. Also, they be the agreement here, as a Minister of Finance. Emma, go ahead. Then we can talk about how to implement it. We see a fine share budget. Enjoy into amunya then. So I think sir we should be. Shall we, mommy? Next. O papa nurse. Oba nurse. I was a nurse. Anka condition omu kan wa se obeti ase kakra. But if I didn't ya na dey empamu omu. Empamu nurses ni nyina. Ana embe pamu nurses ni nyina. Le enkofa grassroots kona. Omo mo ye from grassroots. Foot soldiers in that state. Let's recognize every profession and make it work. Since I'm not spending once a much in the every more.
Yeah.
Only one nipani no. Yeah, they are done 24 hours. You know, we didn't buy a people on the number. Everybody is important.
Mate, Ora Jordan, me and Nasi, o picture, yes, show a Hano space are not shown in any easy crowd.
I'm a spec man. Ramo, the same charge I went to me now.
Wow. Inti Ghana Hano, what true workers in Namodo do I bear saying?
Yendo, as I speak to you, the private. I don't think we even get to 500.
I'm on 500. That's what the private crack can.
Yeah, I think so. Yeah.
Wow.
And also,
now is it a Juma like constantly amount for air applies on baby na?
Thank you. Our workers be doing. Can you prepare? And that's what is in the mouth. What is a part of the things I be saying a clearance? Na engine perform the kind. Sa ejumuno me catchro it is obi penal for Senator Obejane.
Yeah.
There were a lot of security people and they also say all this new way. We don't move back 2 days nipa no sa kon or back.
Yeah.
If you want to me, it's not easy handling all scenarios of death.
That's true.
It takes more than just tenacity. Yeah. Obi awe wu of ni dem 3 days. We nya le fantastic. Or pro, pro. It's not a joke. Obia when you diabetes, so when diabetes is chronic be that. Very day. Obia when you cancer, the breast meaning pro. Obia wash it. Obia just in the near proponent. If I want to count them, it takes real men to really work at the mortuary.
Are there women who work there as well? And
yeah, these days we have about 2 or 3. Even Omokra we have not seen women are interested. You see, lifting of bodies
yeah.
And again, most of the job is being done manual. The body last time the body be by one facility. Nipa 6 into the pejano.
Hey.
Yes.
And then nipa ni mo edu.
Nipa ne the day we are saying jani na we do.
But I the continue me busa asa question and say na me share yeah, I get it. Now me say you were a pipeline yeah they build ABR the next generation of mortuary workers into
what at all?
Into workers bear 500 na wo sisi ano. Say emfa say in the next 10 years. Yes. Na say omu nyina eja adwuma na say o makwa retirement na bibia. Are you sure say e benya nkofa mama yes adwuma no?
No, per the way we are running this country, and the way we are running the sector, it's very difficult. Because for over so many years, 60, 70 years, you know, Obian for you and say my setting up small, you be a fan training more to me, be no one enough. Yeah. A bit nipple. After a Pentecost investment, some year cost to be almost crying practical. So we bet na question monetary management this I didn't know about much want to be so indeed I don't see. But there is an act of parliament. I have agency MOFA. What MOFA? a funeral.
Yeah, my who's high agency, yeah.
Now, Dr. Trefo, the past registrar. As I speak, I think this government have also brought a registrar and a book. They have a mandate. A mandate is on the pair courses, training programs, license of practitioners, but we are not making provision to train anybody to come and join.
And that's where the real issue is.
That's where the real issue is. That's where the real issue is.
Yeah, I mean, 10 years from now, we might be in deep trouble. If
I am even thinking that as we speak,
Hello? Okay. Too bad. Ahomanimu assay, but I think but I'm just saying, sir, Honorable Sam George, a press conference and na or the atuja from July 1st, there will be a 10% increase in data bundles. Mon check him, I say no cry. 10% increase, it means also telcos to implement new changes on data bundles. 10% increase. Is it increase in the bundle value? And I say sika yebetia for bundle na yetia 10% more. Now your bundle na man for any boy in the day. Anyways, after this short break, we'll delve into some issues, no some more. Kale charcoal toothpaste. Yeah, kamfo ede amount. Me pacho. So nim de bidie etumi ya. Bidie was some absorptive properties bia. Eti wenum eyi bacteria eyi inka eni bibie free wenum. Di bidie de ye pa. Nti na inka ne no. Udi bidie frabo di trade di twitwi wo se a eyi wo se so fita kama. Na eyi Samara Company Limited atenase ena omafa bidie afa through strict hygienic conditions edia Kale charcoal toothpaste. Ema white teeth, ema fresh breath all day long. Oye penyi, oye akwala 6 years and above. Ubetimi atobi na unsu we yusu. Kale charcoal toothpaste, another quality product from Samara Company Limited. From it was 0246 864798. Na only one into me inni enkomo. Omo boagana for papa. Kale charcoal toothpaste. A brutal men Canada. And now the University of Gold Coast. And so say leadership is not about position. It's about wisdom at the helm. And join us at the next Great Leader Summit 2.0, where two of Ghana's foremost thought leaders, Dr. Gideon Titi-Ofei and Dr. Mensa Otabel, will share insights to shape the next generation of transformational leaders. Theme near wisdom at the helm of affairs. Date 21st June. June here 21st 2025. 9 a.m. near Shas. Venue no University of Gold Coast Hall, Accra Business School, was Spentex Road. Upasa register. Just log on to titiofei.com/event. titiofei.com/event. Sa conference way and as a summit way no. We've designed it specially for executives, for visionaries, for entrepreneurs, for public servants, and all who aspire to lead with integrity and impact. If you see yourself as a leader, please be part of this summit. You will never leave the summit the same. In this month of June, Go TV Semen Kantremo. Go TV. Almost say they've got something great for you this month of June. If you are looking to make movie time an enjoyable experience, then look no further than Mnet Movies 4. So Go TV, Mnet Movies 4 near channel 150. Channel 150 and Mnet Movies 4. Classic movies are guaranteed to make you laugh louder and bring out your inner child. And Mnet Movies 4 is guaranteed to lift your spirit. It's a perfect blend of action, comedy, and drama with movies such as the Fast and Furious movies, your Ocean's 8, your Bridget Jones' Baby and Fall. You can also enjoy classics, BTS Shrek movies, Mr. Bean's Holiday, Edos movies, Bebre, Natty Professor, and the likes. There is something for everyone in the family, and they get to enjoy it all from the sofa on the go with Go TV Stream. Inti fear Go TV, decoder, share camera. Baby tu kwai, nifie. Ba mobile phone or access to internet, you can stream into Go TV Stream. Ubetme streaming, no so share. It's a fun-filled ride, and you can be part of the laugh and the loud moment, the O's and the R's, by staying connected on *759#. *759#. Go TV. Love it. Inti June we dey share movies on Go TV. Now unim say edu Mother's Day ye nyina ye tie maame no mu enim. Edu Father's Day na akwa bibia wonti ye tena ase Asempa FM ye ka se dabi. Se obia mpo nya hwe ma fathers Asempa FM nko ade ye de ho asi ho. Say you will do something special for our fathers on Father's Day. Into your papa na wutie mi abonsem ma Asempa FM na peneyen ya ye adwuma. Into ye de papa ayiko ebai. Every year Father's Day ye papa ayiko. This year ye papa ayiko 2025. Asempa FM papa ayiko 2025. It's an amazing Father's Day celebration this June. Date near 15th June, and 10th. Into 5 days from now. 5 days from now, and a Father's Day. Me pacho. It's that time. That day is Dominic is here boy birthday. Into the birthday on Father's Day. No, Charlie. Dominic brutal. It's that time to celebrate the amazing father figures who, with love, with care, and a heartfelt support, have touched the lives of children. Omuamuma ene emma enye won man kasanti enye won biological children. But ma hwewon papa no bi eye pao. Me say me ye papa and me jitum say me ye ni papa. It is a mode frase papa fo nyina say papa fo nyina ye irresponsible any ade a. Ja. Na ma haye papa because me I cannot for the life of me become irresponsible. No. Enti papa no bi te say ye no. We have to be celebrated. Well, because we've touched lives. And yeah, man kwa. Enti the year ka Asempa FM can say foul phone na record a 1 minute video. Na send the my WhatsApp. Enti in that video no share the beautiful moment of how these wonderful father figures have impacted your life. Enti ebia wo papa bi, o spiritual father bi, o mentor bi. Will impact your life directly, positively. Yeah, 1 minute video, uboni din, what can you more touch you, but it should be a fantastic story. You know. And once you do that, you stand the chance to win some amazing prizes for your dads on Father's Day, come the 15th of June 2025. Deadline for submission of entries, you know. Ochana. In the end, I would say me, yeah. Ochana 6 p.m. na deadline and no. In the video no fabra. WhatsApp number ni 0531 trotoho 0531 003813 0531 003813. Show papa no nyama papa feel proud kakra 0531 003813. Yes, our 1 minute video can be your papa yama. Na send the Brian 1 minute. You be review videos thing na the best stories you be pick it. You be chama dear sa ube dwane afikroma. Enti Sunday ye nyina ye hiem 9 a.m. pepepe. Na nya no nko an. The area ne say you be say a free prostate health screening. When the prostate no ja ha manfo kofo ube gunsuo wi obo say wa wote say insuo ni bi da so aginem unya hu ne sa in fact yakase once you turn 40 years e was say unya regular checkup of your prostate, very important. In the yebeye bi achemu free the executive prostate center omoba Asempa FM ha ya premises e wo kokomlemle multimedia he ya ene yebeye no in the fa papa bra ne yebeye no free prostate screening, free celebration of our father figures alongside musical performances. Na ya sema mo buffet papa bi mo medidi peche o mo didi peche. Ini send entries, phone into our programs, and let's engage on our social media platforms for a chance to join the celebration with your father figure. Stay tuned. Asempa FM, Adum FM, Adum TV for more heartwarming stories and dedications this Father's Day. Ain't Asempa FM Papa Ayiko 2025 Executive Prostate and Herbal Center. Uye cured omo boye. NASC Scientific Clinic. Nyankopon kwane yaresa for. Compu Ghana, Passion for Technology. Las Palmas Food Center, Adriane Pafie. Franco Trading Enterprise, Phone Papa Pafie. Day Purified Drinking Water, Water for Life. Tasty Tom Seasoning Powder. Taste ni flavor. Afa. Exodus Moringa Capsules. Exodus Dandelion Capsules. Ehwa dansidie no edoso. 3P Garlic Mixture. Naturally organic. Papa Ayiko. This year, Charlie Baby Intibra. And let's celebrate our fathers this Sunday. And from 9 a.m. Is it Sunday?